Hi everyone, we are at Dr. Karishma Aesthetics to the first edition of the Doctor's Diary. I am Dr. Karishma Kagodu, plastic surgeon here, and I'm going to introduce you to our senior dermatologist, Dr. Prerna Sikka.
Hi.
And Dr. Nisha Thakkar, who is our senior cosmetic dentist. And we are going to discuss about expectations of patients, myths versus reality, a few facts, and we will talk about how the evolution of aesthetic medicine has happened in plastic surgery, cosmetic dentistry, as well as dermatology. Dr. Prerna, let's start with you. And tell us, over the last 5 to 7 years, as you have been in the aesthetic dermatology practice, how you have seen things evolve in terms of treatments, and give us a little update about what's trending also.
So, skin and cosmetics has come a long way, whether with respect to hair or skin, both have come a long way. The latest these days is exosomes, which are stem cell derived growth factors, which can actually do wonders for your skin, hair. They have indications for hair growth, for skin rejuvenation, scarring, pigmentation, whatever indication it may be. So that is one aspect which has changed. Also, peels have changed. We were doing single peels. Nowadays there are so many beautiful combination peels in the market.
So what do you think now? Like right now the weather is so dry, my skin feels so dry. What about you, Dr. Nisha? What do you think? Like especially me, I already have a dry skin.
Yeah.
They did single peels then. So when you talk about now multiple peels, what are the general peels? Can you tell, like in general, how the peels gotten better? Do you use it together or use it separately? And for this season, what can we do?
See, this season, especially February, March, in a place like Bangalore, it's very, very dry and, the skin seems extremely dull, dehydrated. So your basic simple peels actually should be done with great caution. Any acid-based peel, if you apply on dry, dehydrated skin, how much ever care you take, it can burn the skin. So I would prefer slightly thicker gel-based peels, little milder peels, or a leave-on peel is safer to do in this current situation as compared to your basic glycolic peel or a basic peel which is pure acid.
What about glycolic and lactic peels? Yes or no?
So it depends. If it's a younger, oilier skin, anything is fine. But for older skins, I would not in this current weather want to do an acid-based peel.
So there can be situations where some of these chemical burns and it happen, and a lot of patients could have an excessively dry skin, and sometimes you do these chemical peels and a few minor burns. So is it something dangerous? Because people get scared. I did a chemical peel in a clinic and they create panic everywhere.
Correct.
And then they're very scared. Oh my god, I got a few burns. So is it a normal side effect and can it be treated? And does it happen?
See, definitely people are going to worry if things like that happen. But we have, even with all the precautions we take, it can happen to the best of us. So when something like this does happen, please handhold your patient. Please explain to the patient, talk to them, let them know that, it's superficial, it's temporary, it will get okay. Give them the prescribed creams to soothe the skin down, calm the skin down, maybe some hydration treatment or mask. But yes, it can happen with the simplest of peels and the greatest precautions. It can happen to the best of us.
But it is treatable.
It is treatable. It is treatable, but you have to handhold them because they will be worried.
No, because the audience here, all of you tend to panic if there are small burns, and it has happened. Whichever clinic it is, I think it's very important. Don't panic. Everything is treatable. Go back to your doctor, your dermatologist, and as Dr. Prerna said, it's nothing like it's a complication, but it's sometimes a side effect which cannot be avoided even in the best of hands, but can be treated. So meet your doctor, don't run away, and I'm sure the doctor will hold your hand and take care of
solution,
it, right?
Yes.
So, what about hydrofacials? Like, is that better, or chemical peels? Like someone like me who has normal dry skin. What about you, Dr. Nisha?
Yeah.
What kind of skin do you have?
I have combination oily skin. You know my skin better.
So tell us the best for me and tell the best for Nisha right now.
See, hydrofacials are a safe thing for anybody and everyone. Okay, so it's basically like polishing a surface which will reflect light. So that's the basic principle. So anybody and everybody can do a hydrofacial safely. Okay, so it is for everybody. Chemical peels, it depends on the skin type. If it's oily skin or dry skin. For oilier kind of skins, I would prefer to do a glycolic or a salicylic based peel because that will help in the acne as well and the pigment and everything. So I would choose those peels. For drier skins, I would choose a more hydrating peel, like a lactic acid peel or something like that, which is slightly milder. Or for older people, I would prefer to do hydrofacial as compared to, a pure acid peel, which is my opinion, but I think that generally works well and is safer.
Yeah. So also for all those people, like I personally had done a body peel just a week back, and the chemical peel is called a phenol peel. And doctor advised, usually we do these peels. I got back from my New Year holiday extremely tanned and have been moisturizing sunscreen, but it takes a long time on Indian skin for tans to move. So it's safe. You just have to have good sun protection. And wow, that's lovely inputs. And let's go to Dr. Nisha. We have our cosmetic dentist here who's bringing smiles to all of you every day. Nisha, tell us in your last 10 years experience, what do you see which has evolved in cosmetic dentistry? And from like 5 to 7 years back, what were you doing then? And now, what are people asking for? And what are the few myths which are present around cosmetic dentistry?
So nowadays, I think people have become more conscious about their teeth, taking skin also into consideration. They also think about how the smile is. So initially they were more like braces and all, but now they have become aware and they actually want something that is invisible. So Invisalign, they're more aware. They are, even kids, like our youngest patient is 11 years old. He has started, going for Invisalign. And the oldest patient that we have is somewhere around 60-year-old.
Wow. So when did Invisalign come into India?
So Invisalign, to be very frank, has been in the market for almost 20-25 years. It's just that in India, there was not much people aware about it. Okay. But now people have become conscious and they are inclining towards something that is aesthetically good and also working better than braces.
Right. So I know as a young kid, I did have those steel braces and they cause ulcers and breakout. I wish there was Invisalign or we had it back in the 90s. Well, but yes, about the, it is a tad bit expensive, as compared to the regular braces. But so how would you compare like the results? Now, at our clinic, we are having Invisalign since the last 6 years now. And patients are extremely happy. Of course, because they don't have to keep coming to the clinic, right?
Yeah.
But what about the cost? That is a little concern factor. So what do you say about it when you compare with braces? And of course, at the end of the day, we have to give results.
So Invisalign claim that they give better, faster result than braces. So economically, I wouldn't say it goes on an expensive level. It's okay. It's not so expensive.
Is it worth a lifetime investment?
It is worth. It is absolutely
worth it. Yes. So what else do you think is trending right now in terms of smile makeovers?
It's also veneers that people are more keen about. Rather than going for some silver fillings and all, people have come out and going on for composite fillings, veneers. Just to give a whiter shade, proper shape and size.
Like the perfect teeth and alignment. That's what
smile makeover.
I had a friend who asked me Lumineer. So is there any difference between
Lumineer
and veneers?
Lumineer is okayish and veneers are a better state.
So it's a quality-wise?
Quality-wise.
As we say.
Yeah.
So, and what about teeth whitening? Like, I just want to walk in and, get just right in, but I don't want to do all of the extensive.
We say it's a lunch break treatment. You just come, get your teeth whitened and go. Just a 1 hour procedure and you're good to go. No downtime, no restrictions, no nothing.
So, your lunch break treatment for dentistry is the laser teeth whitening. Yeah. Dr. Prerna, what's your lunch break treatment in terms of scale?
I would say a carbon laser, a Q-switched carbon laser, because it takes literally 20 minutes, gives you that instant brightening, bleaches the hair also, reduces the pigmentation, helps with active acne, refines the pores, and if you have you don't have too much time and you want a quick thing and something to be effective with no downtime, without your boss knowing you've stepped out for lunch break, do the Q-switched.
Well, when I talk about lunch break treatment, they come to me for Botox and fillers. It's like a walk-in, walk-out. When it comes to plastic surgery, I don't think it can be a lunch break treatment. It's a little bit of the morning schedule of mine. But yes, I think one of the shortest plastic surgery procedures that I do is a breast augmentation with implants. Nisha knows it. So it's like 30 to 40 minutes. They come in the morning and post lunch, they are out of the clinic. And that's probably my shortest plastic surgical procedure. Well, yeah, I could go on for hours in the operating theatre. And well, can we talk about a few misconceptions that people have these days when it comes to what about skin? Any very specific thing someone has asked you?
People, I don't know why, a lot of people have this issue that if I'm putting an injection, automatically they're going to look puffed up.
You mean fillers?
Yeah, no, they don't know the difference between Botox and fillers. They think if you're doing any kind of injection, even a hydration booster or anything, they think they're going to look like like extremely puffed up.
Yeah.
So they don't have that knowledge. They have to be told, that we will only put how much you want to put. But if you ask for more, yes, we can give you that look as well.
Yes.
So that is the main issue. Botox is completely different. It will not volumize. Threads are different.
Yeah.
Only fillers will volumize. And that also you have to, if you are clear with your injector as to what you want, they will follow that.
Yes. So just to be clear, Botox is done only to relax the muscles in areas to treat the wrinkles so that the wrinkles appear much less. So we do it for wrinkles on the forehead, your frown, your crow's feet, sometimes when there are drooping corners of the mouth. To tell you, masseter has medical indications also. We use it for migraine to treat injecting the muscles which trigger migraine. We use it for excessive sweating in the palms, feet, underarms, where we can control by injecting minute amounts of Botox underneath the skin. We are relaxing the muscles around the sweat gland. Hence, the sweating reduces. So, Botox has, muscle relaxation properties. Fillers are to volumize an area, thereby rejuvenating because we use hyaluronic fillers. And of course, threads is to lift tissues. So, I think we're clear.
Yes.
So, coming to cosmetic dentistry, do you use Botox? Has it been used anywhere in dentistry?
We do use if people have gummy smiles.
There you go.
Yeah, that's a very common myth. Also, people don't know, people are not aware of this thing. It's when dentistry meets plastic surgery, we come to that, diagnosis.
Yes. So I have patients coming to me who have called the gummy smile, where there's excessive gum show. There could be two reasons. One, they would require an orthodontic correction. So that is when I get our doctor to see the patient to see can the teeth be aligned, pushed back a little bit. Second, the lips could be thin.
Yes.
So we do give them the option of an upper lip filler injection. And orthodontic treatments take 1 to 2 years or longer, and someone doesn't want to wait for that long. So I do what we call a lip flip, where we put filler injections, hyaluronic fillers on the lip, and we also add a tad bit of small units of Botox to relax the muscles, because the gummy smile is caused with the overactivity of the lips on the upper side. So we relax the muscles, the lips drop down, and then of course we do have fillers to do with it for the time being to correct the gummy smile till your orthodontics takes place. So I think that's what I love, and the idea of Dr. Karishma Aesthetics was this. I think we're almost completing 6 years, and our whole aim was that we have everything aesthetics under one roof. And I think most of our patients need each other.
Yeah.
So after my plastic surgery, we have a few scars, of course, post-plastic surgery. They do need lightening because most Indian patients, they tan, they get bruises or the scars become thick. And then, Dr. Prerna has to see them, and then she starts with CO2 lasers for the scars and pigmentation. And yes, when it comes to the face, we have a lot of procedures where plastic surgeon meets the dentist.
Buccal fat removal?
Yes, you're right. So, buccal fat removal procedure being another very simple procedure being talked about these days a lot, and it's all about that the inside look. So in those cases, I do take help of our dentist. We also have some visiting maxillofacial surgeons who come and help us out. So in general, Dr. Nisha, what would you say right now should be the go-to for cosmetic dentistry, and what particular myth you'd like to bust for everyone?
So people also not only injecting Botox and fillers, people also get scared when you inject intraorally. They feel giving a local anesthesia will harm their eyes. People are not aware of the fact that the nerves are different.
Right. So when you give a dental injection, you're just numbing a nerve. So you just give injection to a nerve, so nothing's going to happen to your eyesight. So here we are at the end of the first session of Doctor's Diary with Dr. Prerna, Dr. Nisha, and your next door plastic surgeon. I hope you enjoyed it, and we're going to have more sessions coming up every month. Do stay tuned. If you like the video, press the like button below and subscribe to our channel.